Okay, good morning, everyone. My name is Edward Ng. I'm with the Pittsburgh Foundation. Welcome to our webinar series. I just wanted to do a couple housekeeping items here. This webinar is being recorded for future use. We may be publishing it on the web. We ask that you hold all of your questions to the question box, and we will answer your questions back after the webinar. That's really it. I'm going to hand it over to Phil Koch. Good morning, Phil.
Good morning. This is Phil Koch of the Community Foundation of Westmoreland County at the Pittsburgh Foundation and the Westmoreland County Nonprofit Network. Great to be here to make sure that we are opening our lines of communication between the county and those that are putting forward responses and meaningful responses to make sure that all of our vulnerable populations are taken care of. And our providers, you all that have been working so hard on the front lines to make sure that folks are safe in our community. We have a full agenda today. Just as a reminder, I'm going to ask our speakers if they could hold their comments to about 5 minutes or less, just to give a brief overview, a brief update. We have lots of speakers today, so I want to make sure that we jump right into it. We'll start with opening comments as we usually do with Alyssa and Cholodowski, United Way, and Dirk Mattson. Then we'll move to Dr. Fox, Bud Mertz. We'll move over then to the IU with Dr. Conway, Jennifer Miller of the Food Bank, Deb Thakura, Mandy Zalik, Michelle Whiting from the Area Agency on Aging, and then finally Tim Phillips. So I'll just start quickly by reminding, I don't have a ton of updates from the Community Foundation side, other than a reminder that we do have grants available for nonprofit organizations, specifically those that are serving our most vulnerable populations that have annual operating budgets of under $5 million that need general operating support. So if you are in that category of having an annual operating budget of under $5 million in need of general operating support, we have grants sizes between $5,000 and $25,000. Just visit our website. Right on the front page of the Community Foundation's website, you'll see a link in order to apply for those. To date, we've already approved grants, just over $400,000, and those grants are going to start going out the door next week. So if you are somebody who's already applied, be on the lookout. You should get the acceptance or decline letter email from the Pittsburgh Foundation this week or next week, depending on how when you applied. We sort of did it by sequence. So from there, I'm going to go ahead and pass it over to Alyssa Cholodowski from United Way. Alyssa, do you have any updates for us this morning?
Let me unmute. Good morning, everyone, and thanks. Just wanted to remind everyone, 211 is out there for people to call. We have emergency basic needs grants available to individuals to help with housing and utility issues that they're having right now. I also want to share a new service that we started this week through the United Way to help older adults and people with disabilities to get their groceries for free delivery. So we have a phone number that I'll share with Dirk for the website later on today, but they can call that number, and we have volunteers who will take their grocery list, form a payment, shop for them at their store, and then bring the groceries right to them at their homes, so that these high-risk individuals can remain in their homes and they're not out at the grocery stores. Really excited to have that available. Please, make use of that for those that that could use this help. And I'll send that information to Dirk, so it'll be on the resource page. Thank you.
Great, thanks so much. I appreciate that. And speaking of the resource page, one of the things I forgot to mention is that on our PowerPoint today, at the very bottom, you'll see that URL, and that goes directly to the county website that lists all of the resources that we'll be talking about today, all of the resources that we've accumulated from these Thursday calls. And I want to thank Dirk and his team for hosting that and putting that together. Dirk, do you have any updates for us today, or did I steal your thunder about the website?
No, I'm glad you said. I was going to cover that, but I'm glad you did. I think we've answered most of the questions. There's still a few that are outstanding that we're still working on, but I think 80 or 90% of them are answered. And some of them, I actually have a couple in my emails that I'm getting ready to put up. So if you haven't seen an answer yet to your question, it'll be coming soon. I also wanted to mention that if anybody out there wants to join as a panelist, shoot me an email with bulleted points of your agenda. And I can't guarantee that everybody will get on, but we'll certainly consider it. The more you relate to the COVID pandemic, the better it'll be, or even in some tertiary way, because we've had several that, maybe, or certainly in my eyes, directly related, like Westmoreland County Drug and Alcohol Commission, WICSI, that does the base service work for mental health. Tim is on this morning. Community Action. I mean, there's a lot that definitely relate in my eyes to what's going on in the county. So shoot me an email, shoot me a couple of bullet points when you send me the email of what you want to address whenever you get on. That's all I have, Phil and Alyssa.
Great, thanks so much. We're going to move on over to Dr. Fox from Excella Health. Dr. Fox, are you with us today?
I sure am.
Great.
Can
Go
you
for
hear
it.
me?
Yep.
Good morning. Good morning, everyone. Thank you for having me. Just give you a few updates about Excella Health. Currently, we have 6 patients with COVID-19 in our hospitals. This is down. We had a high in the 20s, so we're very excited about that. We have 21 patients under investigation. We're cautiously optimistic that we are entering the containment phase here in Westmoreland County. If you had a chance to see what the governor had to say yesterday regarding the number of cases per 100,000 individuals in a community and having that number stay low for 14 days, I think we're heading in the correct direction in Westmoreland County. We have started to do some in-house testing at Excella, and our hope is to use that as we start to liberalize our ability to do surgeries. We anticipate that that will happen at some point in May. I'm happy to report that we do have adequate PPE. We are reprocessing PPE and N95 masks, and we're hopeful to start offering that service to some of our skilled nursing homes because we know they need some assistance with extending the life cycle of the PPE that they have. Our teams have been incredibly humbled by the outpouring of thanks to them from the community, and we're very happy about that. So we've mounted a campaign internally with our physicians and staff to support the food bank. So we're hopeful that we'll be able to provide the means to help feed individuals who have food insecurity in our county. There was a question last time regarding 911 folks, and I think Bud will answer that when it's his update. That's all for me.
Sounds like some very positive information. I appreciate that. And once again, I do appreciate all that you're doing and that you take the time to come and meet with us. Thank you, Dr. Fox. Thank you.
You're welcome.
Let's move on over to Bud Mertz with Public Safety. Bud, what do you got for us today?
Good morning, and again, thank you for this opportunity to share what the county government is doing as far as our preparation and continued work on our on the 911 side and the emergency management side. Just to highlight, I think that there has been some discussion, throughout the when the COVID came into Westmoreland County, and there had been a huge public outcry that they wanted more information instead of just a number associated with the county. They wanted to drill down where the cases were, and the public was one thing. We on the public safety side was another, because we felt it would have been important information to have so that we could do the proper planning and notify the right first responders to give them information. We had advocated that through the Pennsylvania Emergency Management Agency, trying to get better information for a long time, and it just wasn't happening. Recently, the Secretary of the Department of Health had agreed to share addresses with the county emergency management directors, so that with the sole and only purpose for us to take that address tag it into our CAD system, our computer-aided dispatch system, which maps our calls, so that we could pre-warn the first responders going into it. That was a good idea. However, when the Department of Health came out with a huge amount of stipulations with that, it basically made that non-operational to even put through. The story would be the only reason we could use it, again, is to tag an address in the CAD system upon a call from that residence. Then we have to notify the incident commander, but before we tell the incident commander, we have to get a statement of non-disclosure from that incident commander. And so that basically made it impossible, because then at that point, there's a statement of non-disclosure. That means if that incident commander, be it a fire chief or anybody else, would have then shared that information wrongly with anybody else. It can't tell his crew. It can't tell the mayor of the town or anybody else like that. If they would have shared that information wrongly, the penalty to Westmoreland County would have been huge. One of the stipulations, there's a list of things, if you violate this, a list of things that came back to the county, but one of them was the loss of our 911, what we call Act 12 monies, but it would be the 911 funding for that we get off of the phone service tags, and that would have been close to an $8 million. So you know, the county commissioners had to sign a non-disclosure agreement. The county commissioners, on their signature of non-disclosure agreement, would basically vouch for the incident commander being aware of this incident and not telling anybody else. And how do you not tell anybody else when you're responding to a case? So in short, we've talked to the fire chief, the police chiefs, and the EMS directors, and it was just a consensus all around that their best approach is to treat every residence they go to and every person they come across as being a probable or possible COVID positive person. And that's how they are enacting it out in the real world. And they've agreed with us that the Department of Health has made that initiative basically impossible to enact, then go forward. So that's where we're at right now with it. I still say, though, that we are also still screening calls at the 911 center. So if you dial 911 for any type of a medical emergency or any type of an incident that would indicate a symptomatic person, but any medical calls that you get, we go through a screening process that was approved by Dr. Jenkins at Excella Health, who's our medical director for the 911 center as well, is approved by him. That goes through a screening process, and if they answer yes to any of those questions, we notify the responding entities. In most cases, it's an ambulance, that there was a yes question answered that way. So we're trying the best we can to protect the first responders. You know, unfortunately, the snag that the Department of Health put into the initial thing, you know, I like to say that we find these barriers and we break through them. And we did break through them through good communications with our first responder communities, as well as, you know, putting other initiatives in there like call screenings and the issuing of PPE to the first responders. We've, as well as CDC guidelines, I think that we've broke through those barriers as we move forward. That's all I have right now.
Great, thanks, Bud. Appreciate your work and your report. We're going to move on over to Dr. Conway. Dr. Conway, if you want to talk to us a little bit about education in the county. I think you're on mute there. Still don't quite hear you. Go ahead and try it now, Dr. Conway.
Now I'm unmuted. Can you hear me now?
Yeah, I can hear you now. Thanks.
There
Go for
we
it.
go. Yep. All right. Yeah, no problem. So thank you so much for the opportunity to provide an update on the education sector. First, districts, CTCs, the intermediate unit, and our lone charter school have been implementing their continuity of education plans now for a few weeks as we move into a virtual setting. If anyone's interested in seeing any of the continuity of education plans throughout the county, you can go to the intermediate unit website at wiu7.org and you click on continuity of ed, and it provides you links to every single district, CTC, and the charter, as well as the intermediate unit's continuity of education plan. So hopefully that's a helpful resource for folks. Also, over the last, from April 10th through the 17th, districts were applying for equity grants. I'm sorry, the 6th through the 10th. We're applying for equity grants that the PDE had offered about $5 million for districts who were struggling to get kids connected through their continuity of education plans. The criteria that PDE used was 40% free and reduced lunch metric. And then what they did after that first hurdle was they ranked districts and CTCs and IUs to the availability to students to participate in those continuity of education plans. Good news and bad news. The good news is our district must be connecting a lot more students than other districts throughout the Commonwealth. The unfortunate news is only 2 of our districts received equity grants in that, and that was New Kensington at $7,000, and Monessen City, I believe, had around $38,000 in an equity grant. So those are dollars that are going to be used by those 2 districts. The third thing I wanted to share again around funding of schools is that of the CARES Act, the federally passed, and there was chunks of money that were identified, about $100 million in what's called a governor's relief fund that PDE at its discretion may use, and then about $520 million in which is going to be K-12 specific, in which they will use the Title I formulas to distribute that money to districts. So that'll be money well needed for districts during this time. Last thing I wanted to share is the intermediate unit has organized a 3D printing mask initiative throughout the county. We have over a dozen printers throughout the county. Districts are firing up those 3D printers. And I think we have about 125 masks made so far, if not more. Right now, we're trying to secure weather stripping and elastic, which elastic must be like gold right now in this county because we can't find it. But we have some leads on some materials, and those masks are going to be donated to the emergency management, and then for them to be able to distribute them to those who need them throughout the county. So that would be my update. So thanks again for the opportunity to share.
Awesome. I love that last initiative. Thanks for describing that for us. Let's move on over to Jennifer Miller with the food bank. Jennifer, do you have an update for us today?
I do. Thank you very much. Can everybody hear me okay?
Loud and clear.
Oh, wonderful. Thank you for having me on again today. We are doing okay here at the Westmoreland County Food Bank. Since the inception, we have never closed our doors. We have been open and in operation. So all of our staff are deemed essential, critical, and we are proud to be able to offer that service to the community. So far, we have distributed over 70 emergency food boxes out of our doors here in Delmont. And we've only had 5 sites that were not able to distribute for us, so we were able to take that over. I know that some of those in May are going to be coming back on board, and we're very happy about that. At this point, we have distributed over 1.7 million pounds of food just since the beginning of the pandemic. That's unprecedented at this point in time for the food bank. So we're very happy that we had the ability to be able to do that for our community. We are going to pre-pack boxes for the foreseeable future. At this point in time, our biggest obstacle is the unknown. So we are just planning to go ahead and continue to pre-pack those boxes and get them out to our pantry sites. Our pantries have been absolutely wonderful. They have been very open to the pre-packed boxes and adjusting their distributions and being able to do drive-through distributions as well as low to no touch if possible. At this point in time, we've seen a lot of individuals coming with some different needs, such as celiac disease, abuse situations where people have had to flee their homes and are in need of food. So there's some really sad situations happening out there in the community, and we're happy to be able to make referrals where necessary and be able to provide the food that they need. We are in a partnership right now with Ray Charlie, with the Charlie Shop and Saves. They have provided Ray Bucks, $20 vouchers that we are able to give to pantries in and around the areas of his 3 stores. So that was about a $50,000 donation from Mr. Charlie. So we are very, very grateful for that opportunity to be able to provide those. And we are able to give them out as emergencies as well for people who are just getting started that may have some special dietary needs and things like that. I'm not sure, looking at my staff, and did I cover everything, guys? Okay, yeah, I think we covered everything that's happening here. Again, we are here. We are fielding calls. We are assessing their situations and referring them out to our very strong pantry framework. We are not doing mass distributions like you see on TV with the Greater Pittsburgh Food Bank. We feel that right now we need to be feeding the need and not feeding the panic. We want to be able to keep people in their communities so that they don't have to spend the gas money to be able to get their food and be able to stay in their communities right where they're used to going or, comfortable going. And as well as, especially for people that are unemployed, we don't want them to have to run to another part of the county in order to be able to get their food. But that being said, if God forbid the pantry framework would ever completely break down, we would be able to set up sites in 8 different areas of the county that we have already designated to be able to do those mass type of distributions. So right now we're pre-packed into May, and we have all intentions of doing it for the foreseeable future. So things are different, very hectic, very strained. But at this point in time, we're moving right along. But I thank you for letting me update. And please, if you have anybody who needs food, please have them contact the food bank, and we will assess their situation and get them what they need. We have people that are able to deliver food. We have people that are coming in every day to help pre-pack the boxes. And thank you to Feeding the Spirit and a lot of the other nonprofits who have actually come and have volunteered to help pre-make those boxes. That has been a godsend to us, and we are very, very grateful for their help, as well as all of our volunteers. Just to give you one other statistic, at this point in time, we have actually seen over 3,000 volunteers come through our doors to be able to help pack those boxes. So we're definitely getting a lot of assistance from the community, but we're here and we're very proud to be able to serve our community this way. Thank you so much.
Thanks, Jennifer. I appreciate that. I know you all are working really hard, and appreciate the positive tone about the great things that are happening, especially the volunteers. It's fantastic. Before we move over to Deb Thacker and Feeding the Spirit, I know Dirk has a couple more things that he wants to slide in to talk about, I believe related to the website. Go ahead, Dirk.
Yeah, I just wanted to make sure everybody was aware that we have the email addresses for all the panelists on the website. We will have the panelists' email addresses on, I hope, by 4 o'clock today, but everybody up to this point is already there. Also, I wanted to mention that there's a registration link for anybody who's not on this call. If anybody's interested in getting on this call, and certainly you can pass it on to your staff or stakeholders, whoever you like, just go to our website and register there. Thank you, Phil.
Great, thanks, Dirk. Deb Thakra, with Feeding the Spirit, if you could give us a little bit of update of what you all have been up to.
Hi, can everybody hear me?
Yep, we can hear you loud and clear.
Okay, great. Well, thank you for having us on. Feeding the Spirit has been very busy responding to some emergency needs of the community, like all of us. For those of you who don't know us, we've been in the community for about 9 years now, serving a weekly meal to anybody in need. We've also branched out over the last 8 years to provide temporary emergency housing in hotels for homeless people and provide rent assistance and some other projects that limit the barriers. We want to remove the barriers, as Bud said, to people getting ahead, to people getting their needs served. So we do photo ID, birth certificates, medical copays, whatever is needed so people don't fall through the gap. At this time, obviously, when COVID-19 hit, we were not able to continue our weekly meals, which we do out of Otterbein Methodist Church. We were very upset about that. We know people depend on all of us in the community to provide them with weekly meals, and we love to serve, and our volunteers do. So we went to Plan B very quickly, and we partnered with the nutrition group who agreed to pre-package frozen meals for us, individual servings, and we purchased a volume of them and got the approval to hand them out in St. Clair Park on every Saturday from 2 p.m. to 3 p.m. The restaurants in town, led by Rachel Flowers of Sundog Cafe and Anna Jo Noviello of Sunset Cafe, decided they wanted to partner as well, and they got 7 restaurants involved to create and make 10 meals each to bring to our Saturday distribution. We had our initial one last Saturday. We were so overwhelmed that the restaurants who are already struggling would partner and do this. It just shows what a fine community we have. We were very proud to say that we were able to serve 270 meals out of St. Clair Park last week. And this week, I'm sure we're going to serve more because the word is going to get out. All of the restaurants on board have agreed to double their meal contribution to 20 meals, some 30, and 3 other restaurants have agreed to come on board with us this week, so it's growing. The diaper bank is going to deliver some diapers for us to pass out to some young parents in need. I believe we're going to have some face masks there to pass out. We're just watching the community step up and say, hey, how can we help? How can we keep people safe? How can we go and modify what we do to still serve the needs of our community? So that's kind of what we are doing on the food end. On the homeless end, we're getting more crisis calls for homeless placement. That concerns us because we've got about 75 people placed in Nights Inn since March 1st. And we do temporary placement, 3 to 4 days, and then they transition either into the shelters or into an apartment or to other places that we can refer. We're working hand in hand with Welcome Home Shelter, Blackburn Center, Union Mission to make sure that people can get into the shelters if they can, but there's been some limits put on that. If people come from out of the county, they have to get tested. So what we're doing is we're offering to extend the hotel stays as long as needed until they can get more secure housing. So we've had to really modify that end of things, and we've had a lot of support from the foundations, the community, for donations of that. So that's a brief update from us, and thank you for letting me speak.
Deb, what on Saturday, the distribution you said is at 2 o'clock in St. Clair Park, is that correct?
It is. It's 2 p.m. to 3 p.m.
Great. Great. Thank you so much. I appreciate all that you all are doing in the community on the grassroots level. Mandy Zalik, I see you there, and can you give us a little update on Westmoreland Community Action?
Hi, can you hear me? Okay,
yeah,
good.
Just fine.
Thanks so much for allowing us to come on and kind of talk a little bit, to share a little bit of what's happening at Westmoreland Community Action. And I know last week, Commissioner Doug Chu kind of shared our website, and that we have survey links. We have resource links on our website. And so I just wanted to let folks know that we've been trying to keep up with that, our resource links. We have one that we've been keeping up for years and years that has just a variety of different resources in the community, as well as a COVID-19 responsive resource link. So those are up there. We try to share them on Facebook as well so that people can see the resources for folks, like a lot of the individuals you have had on the call with Feeding the Spirit and the food bank. We also get a lot of calls for referrals in our office. And so if a lot of individuals in the community, if they're unsure where to go or where to reach out, we can connect them to a lot of those different resources. Sometimes it's connecting them directly to 211. And I know Alyssa was on earlier, but just kind of highlighting the importance of having that in our community, and the tracking that 211 is doing for the number of calls that come in. Where we are at Westmoreland Community Action is kind of making sure that as some of these needs are really starting to hit, and Deb, I'm probably going to reach out to you and see if there's some way that we can support as well, as you're looking at some of the extended hotel stays. We've been having conversations with folks, and we're running a survey right now. It's on our Facebook page. It should be up on our website to see where the anticipated needs are going to be for the COVID-19. We all have ideas, but the nice thing is our community is so strong and kind of banding together that we're looking at rental assistance as a need. We're looking at paying for some of those hotel stays, whether it be for individuals that are transitioning into shelter, or for some of our first responders, or some of those kinds of needs. We also anticipate that there's going to be needs for transportation costs, for unpaid medical bills, for some of those ancillary things that there's not a whole lot of coverage for sometimes in government funds and foundation funds. And we're trying to anticipate the gaps that we're going to need to fill. But with the survey and working with a lot of the different partners, we'll be able to know better where those gaps are going to be, and where we need to be putting some funds and efforts for our staff to really fill those needs. So the survey is out there. But for a lot of our different partners, if you want to reach out to me, I encourage that, and we can try and have conversations and see if we can all work together. We fortunately, for folks like the food bank, we're still able to do our emergency food boxes and provide that for some of our individuals, hoping to bring back our food pantry to go live out of our office as well in May. It's always contingent upon what's happening with the recommendations and all of those, but the food bank has really been a great partner and champion in our county. As an agency, we're also looking then at providing food pickups for our Head Start families, so that those individuals going out to our different centers in the communities, just like was said earlier, trying to reduce their transportation costs and gas costs and getting to some of the places. And our families are struggling with kind of getting to those areas and getting to some of the food needs, and may not be able to go to the store multiple times to get the items that are needed, that are not there that day. And through that, we are kind of doing a collection of some of the face masks, so that as we do emergency food boxes, as our staff are having direct contact with individuals, whether it be at our permanent supportive housing, or if individuals are coming in for emergency food boxes, or if we're having connections with some of our Head Start families, we're trying to be able to provide the individuals with masks, because we realize if we're having a hard time getting those, sometimes as professionals, a lot of our consumers are also having a hard time kind of finding those. And those are needed right now for them to go anywhere into the stores. And so we have an appeal out on Facebook, and we're looking to be able to share those out with consumers, or if there's agencies that are struggling, if they've come across some unmet needs of having that, happy to be that individual in that group to help share those around as well. This is the time of the year when we're usually have closed our VITA program, which is a tax assistance program. And unfortunately, this year it's a little different, and it usually brings in hundreds of thousands of dollars into our communities. And right now it's been on hold a little bit because of the decreased face-to-face interaction. We're hoping on May 5th to be able to have a solid plan. And there's lots of pieces that come into that, the IRS, and we have a great partner with the United Way and the 211 system. And so we're hoping that come May 5th, we'll be able to have a good plan for folks who need to be able to do their tax returns and be able to collect on those. Our Housing and Counseling and Money Management Center is still operating. The individual in those systems are doing a lot of phone-to-phone or webinar kind of conversations with individuals. We anticipate a need and seeing an increase in referrals and conversations with that department. And so Whitney, who manages that program, has been gathering resources for individuals, for families as well, to know what's happening with a lot of the different local banks and helping to refer people out to services that others are already kind of doing. And we are looking to partner and continue with our workforce investment issues and needs, and partnering with a variety of different groups on any of the workforce needs with the Workforce Investment Board or other programs to help get individuals connected to whether it be temporary employment or transitional employment, or if they are in a recovery program, to help get them to help fill the gaps of our employment needs that we had already seen before the COVID-19, but we anticipate to come higher once this is all over. That's actually a question within our survey as well. And then probably one last thing to note that was mentioned last week as well was our crisis hotline, our mental health crisis hotline. We're really seeing an increase in folks with anxiety issues and struggles with the COVID-19 response, which would be expected, and a variety of individuals that are having a little more of anger issues and struggles in the community. So I just want to make sure that everybody is aware of the crisis hotline. It's responding 24/7. Our mobile team is still able to go out and provide assistance as well if there's somebody that's in crisis. So our hotline number is 1-800-836-6010, and it's up on our website as well for information. So just make sure that your consumers, your families, sometimes it may be yourself, your staff, that need to reach out if they're feeling stressed or need referred to other treatment and services.
Great, thanks so much, Mandy. Just one quick note. I know that you had mentioned the need to try to find masks, possibly for even the clients that you're serving, so that they have them as they go to get their prescriptions filled or go out into the community. And I know that's something that Deb Thacker has brought up earlier on this call and has been talking to me about that this week as well. So I've been working with Alyssa and Dirk and Bud from Public Safety to try to source some of those masks. So I should have a better, more full update on that next week. But we've got some good solid leads on where to get mass quantities of masks that might be able to be distributed to some of our nonprofits. So we're still in the process of working that out, but that is definitely something that's been on our radar. And we're looking to try to do that more as a system to get large amounts to then distribute out, as opposed to every agency trying to run around to find their own. So more to come on that as the week develops. Thanks, Mandy. Let's go ahead and move over to Michelle, who with the Area Agency on Aging. Michelle, do you have an update for us?
Yes, good morning. Can you hear me? Good morning, everyone. And I just want to thank you all for everything that you're doing. You're very important, and you're the helpers. So my job normally is with Area Agency on Aging, and I am in the administration unit. I was going to be furloughed, and Director Bud Mertz reached out to our agency requesting somebody from Aging to work with them to reach out to all the personal care homes and nursing homes throughout Westmoreland County, because we all know that those have been the hardest hit generally across the board. So my job has been to reach out to them, to try to build a relationship with them and assist them in getting resources that they might need. We have several facilities that have been affected by the virus, and through public safety, we've been able to get them resources and help assist them. My job has extended a little bit now into reaching out to more of the human services field to just try to build up public safety's relationship. I have to give a kudos out to Director Mertz. He realized that there was a deficiency in this area, and he has worked very, very diligently to get it filled. So he is an amazing person, and I want to thank him especially. And we will continue to do the good work, and I appreciate all of you. If you have any questions, please feel free to reach out to me.
Great. Thank you so much for your update, Michelle. Let's round this out by moving over to Tim Phillips with the Drug Overdose Task Force. Tim, are you with us today? Tim, are you there?
I know he's on the call.
There he is. We're having trouble with your audio, Tim. Can you try one more time? Well, Tim, we can't quite understand you. Are you hearing him, or does it sound muffled to you as well? Tim, unfortunately, I think you're muffled and we can't understand you. Edward, are you on the call? Does it sound muffled to you as well?
Yeah, hey, this is Edward. So he's definitely having some audio problems. I would maybe if someone wants to reach out to him and see if we can get him to dial in.
Did you hear that, Tim? Could you dial in, use the phone number? Ed, do you have the phone number handy that you could give it to him? I'm not sure he got it in the email that he got this morning from the Pittsburgh Foundation.
Okay, I'm going to drop off if I switch to phone call. If you can hear me, Tim, on your control panel there, there's an audio section. If you switch that from computer audio to phone call, it'll give you a phone number and a PIN to use, and that will get you into the call. Phil, maybe in the meantime, you might want to round this out for us.
Sure. I could sing a song. I could, Mandy, I heard you were really good at singing.
Sing a song, Phil.
Right, Dirk, I think I've seen you do karaoke as well.
Let's hear the song. Let's hear the song.
You guys could do a duet, maybe.
I don't think they want me singing, Phil.
Right. Well, the other option is that we can always add Tim on to the agenda for next week if we can't if we can't get his audio to work here. So I think that would be the other option is to work with Tim to get him on the agenda. Dirk, are you comfortable with that?
Absolutely.
Great. Let's do that unless he chimes in here in a moment. Just as a reminder, as we close out, just a reminder that at the very bottom of the screen there, you can see the website on the county page for all of the information and all the questions that will be answered, all the resources that we talked about today, the phone numbers, the email addresses, all of that is on that. Is in that website. So thank you to Dirk and the county for putting that together. If you have something to offer as an organization that you need to share, please reach out to Dirk and you can work with him to determine if it makes sense for you to be on the be one of the panelists for next week, or to push that out for into another time. So I think that's all I have. We'll try one more time. Tim Phillips, are you with us? Sounds muffled, still sounds muffled. So Tim, I think what we're going to do is I think we'll go ahead and put you on the agenda for next week, and we'll try to loop back with you then. Okay. Thank you all very much for your time and for all of your work as we address this issue together. Let's stay in contact, and we hope to see you on the call next Thursday. Thank you.
Thanks, Phil.
Thanks.